Okay, good afternoon, everyone. So let's get started. So last lecture, we've introduced a couple of medical imaging modality, right? So X-ray, CT, and ultrasound. So today's lecture will continue to talk about the other couple of very important medical image modalities, specifically MRI, and also nuclear medicine imaging like PET aspect. Okay. So let's start with magnetic resonance imaging, MRI, right? So MRI is a medical imaging procedure for making images of the internal structure of the body. Okay, so here is like MRI image of the human brain. And MRI scanners use strong magnetic fields and the radio waves, okay? So the radio frequency is a source of energy to make images. So different from the X-ray and CT, right? So they're using the ionized radiation. So for MRI, they use magnetic fields and also the radio waves. So here, next we have a short video just trying to demonstrate, right, what is the procedure of MRI, doing the MRI, and the basic principle of MRI to generate the images. Okay.
Magnetic resonance imaging, commonly known as MRI, helps doctors find, watch, and treat medical problems. MRI uses very strong magnets, radio waves, and a computer to make pictures of the inside of the body. MRI pictures are more detailed than those made with other methods. There are many reasons to have MRI. MRI may find bleeding, such as bleeding in the brain. Brain changes, as in stroke. Problems with your back, such as a herniated disc. And an injury inside the body, such as a torn anterior cruciate ligament. Before MRI, you will remove all metal objects. And it's not safe to have MRI with some medical implants. You should tell the MRI technologist about any metal, device, or implant you may have in your body, such as a pacemaker. To prepare for MRI, you will lie on a table just outside the scanner. MRI scanners are very noisy, so you will probably wear earplugs or headphones. Different equipment, such as pillows and straps, will help you stay in the correct position. Once you are ready, the table will slide into the scanner. Most often, closed scanners, such as this one, are used. The area inside is very narrow. In some areas, open scanners are available. This scanner is open on the sides, so you won't be completely surrounded by the machine. However, the pictures may not be as good as with closed scanners. For either type of scanner, a technologist will operate it from the next room. You will be able to talk to each other through a two-way speaker. During the scan, magnets in the machine will create a strong magnetic field. This will not harm you. Then, the scanner will send radio waves through your body. This will not harm you. When the radio waves are turned off, the scanner will pick up energy signals from your body. These signals are used to make the pictures. During the scan, you will have to stay very still so the images will be clear. You may be asked to hold your breath for a short time. MRIs may take 30 to 45 minutes or longer to complete. In some cases, you may get contrast dye with your MRI. The dye helps make clearer pictures. After the MRI, you can resume your normal activities.
Okay, so this video basically summarized the whole procedure of MRI, right? So in the next video, we're gonna see what is the basic principle of using how the MRI is able to generate image of the human body. Okay.
MRIs use protons, which are abundant in the human body. All protons spin, creating a small magnetic charge. When a strong magnetic field is introduced, as is the case in an MRI machine, the protons align with that field. The MRI technician then introduces a radio frequency pulse that disrupts the proton and forces it either into a 90-degree or 180-degree realignment with the static magnetic field. Since the radio frequency pulse pushed the proton against its nature, once this pulse is turned off, the protons realign with that magnetic field, releasing electromagnetic energy along the way. The MRI is able to detect this energy and is able to differentiate various tissues based on how quickly they release energy after the pulse is turned off.
Okay. So in this slide here, the picture kind of summarize the principle of MRI, right, in a nutshell. So this MRI machine, you will see have a large magnet, so it will create this strong magnetic field. Okay, and so we know that human, is composed of maybe more than 50% of water, right? So for water, we have 2 hydrogen atoms and 1 oxygen atoms. Okay. So for each of the hydrogen atom, so we'll have these protons. Okay, so you can think of protons as a tiny magnet. So we have spinning. So when the person was putting the MRI scanner, right? So these protons will align with these main magnetic field. So when the the radio coil, so we'll talk about later, so generate these radio waves. And these protons, the human bodies will absorb some of the radio waves and re-emit some of the energy. So these will be picked up by the MRI machine to generate the image. Okay, so what these radio energy will tell us is, the number of protons, right? Basically tell us how much water inside of different parts of the body, and also the magnetic environment, right? So that's the tissue of the structures. So you will see images looks like this. Okay. So here is image to show some of the main components of the MRI system. And so basically you have these magnet, right? So in the outside create these kind of strong magnetic field. And you also have the grating coil, which is basically used for spatial encoding. And also you have the radio frequency coil, right, to generate these radio frequency waves so that, the body can absorb it and remit some of the energy for the scanner to pick up, generate the image, okay? And also you have a patient table, right? So the patient will lie on this table and send into this closed machine for scanning, okay? So let's look at each of these components briefly, okay? So the magnet is the largest and most expensive component of the MRI scanner, right? So if you look at this picture, so this is a real MRI scanner machine, right? So it's very large, right? It usually weighs maybe 3 to 4 tons, right? So because of the size and the weight of these MRI scanners, usually they were placed in the ground level of the hospital, right? So if you ever try to go to this kind of doing the CT scan or MRI scan, so they usually locate in the ground level of the hospital. And the strength of the magnet is measured in Tesla. Okay, so the clinical magnets generally have a field strength in the range of 0.1 to 3 Tesla. So there's typically 2 types of MRI machines, 1.5T or 3T, okay? So there's also system can reach up to 9.4 T for human use and 21 T for animal systems. Okay, so just to give you, as a perspective, compare with the Earth's magnetic field, it only have 0.5 Gauss, right? So you can see that the strength of the magnet is much stronger, right? And most of the clinical magnets are superconducting magnets, which require liquid helium to keep them very cool, right? So that's why we'll make this MRI machine very large and bulky, right? So you have all these cooling system to make these superconducting magnets cool all the time, okay? And the higher magnetic field strength will increases the longitudinal magnetization because more proton align along the main axis of the main magnetic field. So it will increase the signal to noise ratio. Okay, so in the later part, I will show a comparison, right, with different, magnetic field strength, right, maybe 3T or 9T, right? The resolution of the resulting MRI image can be very different. So we'll see an example later. And this improved SNR can be used to generate image with improved spatial resolution, right? Definitely, if a higher resolution, high SNR image will definitely help the doctors, radiologists to make maybe more accurate diagnosis. So the next component is the radio frequency coil or RF coil. So they are used to send radio frequency pulse and receive the signal back from the patient's body, right? So we send the radio frequency and part will be absorbed by the human body and some will be remit to the scanner. So these will be picked up and used for generating images, okay? So there are different coils located inside the MRI scanners to transmit waves into different body parts. So that's the RF coil. So the next component is the grating coils. Okay, so if you so this is the figure showing where this grating coil is located, right? So the most outside is the superconducting magnet. So the next layer is going to be grating coil, and the inside is the RF coil, just like a Russian toy, right? So these grating coils are used to spatially encode the positions of protons by varying the magnetic field linearly across the imaging volume. So basically, this will allow the spatial encoding of the MRI signals, right? So you can know like the spatial position of the signal, so we can generate image, right, showing the spatial position of different tissues. Okay. So there are 3 different grating coils that are inside the machine. So one for each direction, X, Y, and Z. And they are located within the main magnet, right? So after this main magnet layer. So each one of these grating coil will produce 3 different magnetic fields. So that's beside the main magnetic field produced by the superconducting magnet, right? But they are less strong than the main field. So these coil can create some variable field, magnetic fields that can be increased or decreased to allow some specific and different parts of the human body to be scanned, and also adjusting the magnetic field strength. And we also have the computer system, right? So those different components are used for generating the magnets, right? The grating, the radio frequency is for resonance, right? We also have the imaging part, right? So we need the computer system to be able to, based on the received radio frequency, is able to generate the corresponding image so that the radiologist is able to do some analysis. Right, so the computer system is also embedded in the MRI scanner, have a range of functions. It can control the radio frequency, right? So how the the frequency of the radio wave is being generated, right? And it's also control the gradient pulses, and also responsible for collecting the data and also process data to display the general image on a computer, right? So for the reconstruction part actually has very complicated algorithm that is, using algorithm in the K-space to do the image reconstruction. So obviously there's a lot of details about the physics of the MRI. So if you're interested, so these are some of the references and lectures, talk about the details of the physics of MRI. So if you're interested, you can go to these references and understand better, okay? So those are the basic principle of MRI. So now let's look at the MRI sequences generated from the MRI system. So basically, by varying the sequence of RF pulses applied and collected, so different types of images can be created. Okay, so the most common MRI sequences are T1 weighted and T2 weighted scans. Okay, so what are the T1 and the T2 then? So before we go to talk about T1 and the T2 weighted image MRI sequences, we have to look at a couple of definitions. So basically two definitions. One is the repetition time, and the other is time to echo, okay? So the repetition time is the amount of time between this successive pulse sequence applied to the same slice, right? So those are the time, for the radio frequency applied, okay? And the time to echo, TE, is the time between the delivery of the RF pulse and the receipt of the echo signal, right? So you deliver the RF pulse and then some of the will be absorbed or remit by the human body and also gonna be picked up by the scanner. So that's the echo signal. So turns out tissues can be characterized by two different relaxation times, T1 and the T2. So here are the definitions of T1 and the T2. So T1, this longitudinal relaxation time, is the time constant, which determines the rate at which excited proton return to the equilibrium. Okay, so it is a measure of the time taken for the spinning protons to realign with their internal magnetic field. And T2, which is the transverse relaxation time, is the time constant, which determines the rate at which excited proton reaches equilibrium or go out phase with each other. So it's a measure of the time taken for spinning protons to lose phase coherence among the nuclei spinning perpendicular to the main field. Okay, so those are the definitions of these two relaxation times, T1 and T2. So because of these, properties, so we can vary these kind of TE and the TR, right, to generate different contrast and brightness of the images, and they can be used for the later diagnosis, right? Because different image sequence, they may present specific characters for some of the tissues or disease, so can have better pathology. So for the T1 weighted images produced using the shorter T and the TR times, and the contrast and brightness of the images are predominantly determined by the T1 properties of a tissue. Okay, so for the T2 weighted images, they are produced by using longer T and TR times. Okay, in these images, the contrast and brightness are predominantly determined by the T2 property of a tissue. So these are the two very common MRI sequences, T1 weighted and T2 weighted images. And we also have some other type of sequences. So this one is also very commonly used. So this is called fluid attenuated inverse recovery of flare. So this flare sequence is similar to T2 weighted image, except that the T and the TR times are very long, okay? So in this table, I kind of summarize these different sequences, right? What kind of TR and TE they are used to generate these MRI sequences, right? So these are the approximate TR and TE times for these three different type of MRI sequences. So you may wonder, right? So we have these, we can use different TR and TE to generate these, different sequences. Then what are they look like, right? Why do we care about, these different MR sequences? So here's actually an example to show you different MRI sequences and how the same, the brain structure look like on different MRI sequences. Let's take a look.
Hello, this is Dr. Gay from First Link MRI. And this is just a very short video to show you the difference between some of the common sequences we use for MRI. So you may have gone to your doctor and gotten the report and they mentioned something about something is bright on the T2 weighted sequence or dark on the T1 weighted sequence or blooms on the gradient echo sequence. And you may be wondering, what are they talking about? So MRI has multiple different sequences, different acquisitions. So we'll obtain a T1 weighted sequence and the brain may look like this. And then the next scan we'll run will be a T2 weighted sequence and then a gradient echo and a flare and several other ones. And also we do these in different planes. And you can see that there's a different tissue contrast between each one of these. So they have a unique signature for pathology and normal tissues, and using them all together, you'll be able to tell what is going on better than if you had any one. So for example, a T1 weighted sequence here has dark fluid. So this is fluid in the ventricle, slit-like ventricle here, dark, and fat is bright. So you see around the edge, you have subcutaneous fat, which is this band of brightness. You also have bright marrow, has lots of fat in it. And the T2 weighted sequence, the fat is fairly bright as well, but you see how the fluid is really bright. And the brain parenchyma is more dark, whereas in the T1 is bright. So these differences help us decide what certain pathologic processes are. Now, we have a couple other ones down here. This is called the gradient echo sequence. It's really good for if you have heme blood products, if you've had a prior stroke, it'll show up as a dark area. Or if you have mineralization, like in this patient in their basal ganglia, they have some just normal physiologic mineralization, and it shows up as dark. And if someone has had a stroke or a certain type of tumor that has blood products within it, it'll show up as areas of dark like this. So it's not too good for other things, but just for this one purpose. So we include it in brain scans typically. Now this is probably the best sequence we have. This is a newer sequence, and this is called a flare sequence. And the flare is great because there's wonderful soft tissue contrast. So the T1 images, if you look here, you see, well, the gray matter around the edge, the ribbon-like gray matter, and the white matter in the middle, they look really similar, not much contrast. And the T2 weighted sequences, if we window that, it's a little bit better, but still not nearly as good as the flare sequence. There's very good tissue contrast here in the flare. The gray matter looks like a ribbon around the outside. Is really easily distinguished from the white matter here centrally. And if a patient has multiple sclerosis with little specks, or if they have migraine headaches with specks or a brain tumor, it'll show up really easily on this sequence, whereas it may not be visible at all on the T1 weighted sequence. So you may get to understand now how each one of these sequences is unique. And when they are used together, it'll help us figure out what is going on. And that's it. Thank you very much.
Okay, so those are some different MRI sequences, right? So you can see how they are able to capture. It'll give you different contrast or brightness of different tissue parts, so that you can make, maybe using multiple of these sequences, you can make a more accurate or confident diagnosis. Okay. So just to further give you some of the example here, so we can look at each individual MRI sequences, right? First is the T1 weighted image, so show up on the right. So the fat show up in the as the bright color. And for the fluid, right, cerebral spinal fluid, CSF, right, so show up on the dark color on this T1 weighted image. And we also have gray matter, right? So on the outside, so show up as gray. and also have the white matter show up as white on this T1 weighted image. Okay. And for T2 weighted, right? So the biggest difference may first notice is the fluid, right? So for the T1, it show up as a dark, but for the T2, right, show up as a very bright color on the T2 weighted image. Okay. So this T2 weighted image are good for detecting areas of pathology, although, maybe FLAIR is more sensitive in this case. So this is the FLAIR sequence. So it's akin to the T1 weighted with signal from free water suppressed. So in this case, you will see this fluid show on dark. And the most pathologic is a bright signal on the FLAIR. Okay. And here are like a side-to-side comparison of these three different sequences, right? What, different tissues show up, what kind of contrast on these three different sequences. So you can look at them side by side and see maybe using these three sequences together, you may have a better understanding. Okay. So also we want to show you what is the MRI look like in operation, right? So maybe you've heard of, MRI machines are notoriously known as very loud, right? Have those banging or knocking sound. So let's take a look. So actually, there's a couple of sources can make this kind of noise. So first of all, you have the cooling component, right? So the code has always running to make the magnet cool. So that's one source of the noise coming from the MRI scanner. And also you have these grating coil, right? So they interact with the main magnetic field. So that will cause the coil vibration. So you are heard some of the knocking sound. Okay. But yeah, you can actually hear a different sound in this video. Okay, then let's fast forward. So this is axle playing T2. Okay, this is a coronal T2. Axle T1. Sagittal T1. Okay. Okay, so you kind of get an idea, right? So there's all kinds of strange noise coming from the MRI machine. So it may feels like there's something spinning in the machine, right? Just, like the CT scanner actually have the gantry spinning, but here we don't have anything spinning. So it's basically the vibration causing this kind of noise. Feel like there's something spinning in the machine. So that's the basics of MRI. So let's maybe do a comparison between MRI and CT, right? So first of all, CT is more widely used than MRI, right? Because in some of the diagnosis, maybe CT is enough, right? You have enough resolution able to do the diagnosis. Then, especially if you have involving diagnosis with dense structures like bones, right? CT is very good at doing the imaging with dense tissues like bones, very clear, and it's much easier, cheaper, right? So that's why CT is more widely used than MRI. But MRI does not have ionized radiation, right? So for CT X-ray, you have ionized radiation, but for MRI, only have the magnetic field and also the radio waves, okay? MRI has excellent soft tissue contrast, right? So you see the brain image, right? So you have all these fluid and great white matters show up very clearly on the MRI scans. While CT is preferred for lung or bone imaging, right? So especially for the bones, you can see, detect the fractures very easily. And CT is fast. Typically, seconds can be done for CT scan. But MRI is slow, right? So usually take about maybe 30 to 40 minutes, right? As in the very beginning of the video shows, right, how the MRI is operated. I also mentioned it will take around 30 to 40 minutes to complete the MRI examination. So there are also contraindications to MRIs, right? So for some of the cases or conditions, maybe MRI is not allowed for the patients, right? For example, if you have implanted devices or other metallic devices, right? So like the pacemaker, those implanted electronic devices, because the MRI machine has very strong magnetic field, right? So these metal, implants can cause damage to the internal organs, right? And also unstable patients, right? And because, in the MRI scan requires the patient hold very still, right? So some of the movement may cause unclear picture. So this, could happen a lot for kids, right? So they, kids, they may not stay still for like 30 or 40 minutes. So this maybe requires some, stabilized procedure, right? You have, on the table to help the patient to stabilize, okay? And also the pregnancy, right? So there is some relative contraindications due to unknown effects on the fetus. So this has to be very careful for the patient with pregnancy. So, and also other conditions like severe agitation or claustrophobic, right? Because, for some of the MRI machines, this is a closed machine, right? So very narrow. And, for some patient has claustrophobia, they don't feel very comfortable, right? So you need some, assistant, right? Maybe require anesthesia assistant to help them to go through this MRI examination process. And also there is some safety protocols, in the MRI operation room, right? So in the MRI room has a strong magnetic field at all time, right? So because the machine is always on, and it's strictly prohibited to bring magnetic objects into the MRI room, right? So, so this will interference with this magnetic field. And in general, in preparation for the MRI examination, the patient will be required to wear earplugs or headphones to protect the hearing, because as we saw in the last video, right? So the MR machine make very loud noise, right? So this may cause some damage to the hearing. So we need to have some protection for the ear. Okay, so these are some of the safety protocols in MRI. Okay, so here is an image, as I mentioned, right? So in the strength of the magnetic field will affect the resolution of the MRI image, right? So here on the left is a typical 3T MRI scanner, the image generated by this 3T machine. It's kind of very clear, have some of the different tissues, right, for the brain. But if you look at on the right, so this is the 9.4T MRI machine generated image, right? So you can see, more clear details, right? Higher resolution as compared to the 3T machine. Okay, so these are kind of show you the differences of the magnetic field of the MRI machine, and it will affect the resolution of the resulting images. So MRI can be considered as one of the great invention for medicine, right? So this help the doctors to see the internal structure, especially the soft tissue, very clear, and able to make very accurate diagnosis and treatment. So these are some of the Nobel Prizes associated with MRI. So you can see there's a couple of Nobel Prizes, for this type of technology. So let's look at some of the clinical use cases for MRI, right? So the first example is we can using MRI to detect herniated disc. So this is called this herniated disc. So, as we mentioned, right? So this MRI is able to very goodly imaging these soft tissues, right? So we can easily detect these kind of problem with kind of spine, and is able to show clear on this MRI image. And we can also using MRI image for myocardial infarction detection, right? Basically, it's just a heart attack, right? So maybe you don't have enough oxygen supply to the heart. We can also using MRIs to detect that. And we can also using MRI to detect retinal tumor and also brain tumor, right? So this is the brain MRI, and on the right shows the brain tumor, right? So which is the the colored region, right? Shows different types of tumor in this image. Okay. So there's also another kind of subtype of MRI is called functional MRI, FMI. So this anatomical MRI provides the excellent spatial resolution, right? So for the head and the brain, or maybe other body parts anatomy. So basically, this anatomical MRIs provide the structure, right? The spatial information of the human body. But for some applications, we are interested in the function, right? How the brain works, right? So this functional MRI is a technique for measuring and mapping brain activities that is non-invasive and safe, right? We don't have to have any injections or using needles or detect some of the brain activity. So we can just using the MRI scanner to examine the function of the brain. So this fMRI measures the brain activity through oxygen concentration in the blood flow. So it relies on the fact that cerebral blood flow and the neural activation are coupled, right? So basically, it means when the area of brain is active in use, right? So the blood flow to that area also increase, right? Because we need the blood cell to bring more oxygen to that area, right? Because that part is in use. And fMRI is being used in many studies to better understand how the healthy brain works. And in a growing number of studies, it is being applied to understand how normal function is disrupted in diseases. For example, the Alzheimer's diseases, right? So we can, using functional MRI to look at the healthy brain, how they functions, and we can using that as a reference to compare against the brain with some certain diseases, right? Like Alzheimer, right? What kind of region or show cause some of the certain degeneration of the functionality of the brain. So this is a very common usage for the functional MRI. So here is a very cool animation just to demonstrate what is functional MRI and how it works. Let's take a look.
How does functional MRI work? You might have heard of functional MRI, or you might even have had a functional MRI scan yourself. The goal of this video is to explain how it works. Functional MRI
is a type of magnetic resonance imaging, or MRI. MRI uses a very big magnet inside a scanner to make images of the human body. The human body is made of more than 50% water. Each water molecule in the body contains 2 hydrogen atoms. These hydrogen atoms contain something called a proton. Protons have magnetic properties. When a magnet is present, they interact with the magnetic field. MRI scanners use magnets to measure a signal from protons in the body. MRI is used to make lots of different types of images. Hospitals most commonly use structural MRI. This can show the structure of the brain. Functional MRI shows which areas of the brain are active while performing a specific task. So, what do we measure with functional MRI? Let's look at what happens in the brain when we perform a simple task like looking at something. From the nerve in the eye, signals are sent to a region at the back of the brain called the visual cortex, where brain cells process these signals. Brain cells need oxygen to function. This is transported through the body by red blood cells in the blood. Here, we can see a blood vessel close to a brain cell in the visual cortex. The brain cell is not very active at the moment. When the eye starts looking at something, the brain cell needs to process the information coming from the eye. This means the brain cell needs to work very hard, and so it needs a lot of oxygen, just as you need more oxygen when you're running. The brain cells in the visual cortex demand more oxygen, and the nearby blood vessels increase the amount traveling to that part of the brain. Even more is delivered than the neuron requires. Blood has magnetic properties. These properties change depending on how much oxygen it contains. When there's a change in the oxygen level, the magnetic field around the blood vessel changes slightly. This affects the protons close to the blood vessel in a way that we can measure with the MRI scanner. When there are fewer red blood cells carrying oxygen, the signal we detect with the MRI scanner is lower. When there are a lot of red blood cells carrying oxygen, the signal detected by the MRI scanner is higher. In functional MRI, lots of images of the brain are taken very quickly. The images are then processed on a computer. This creates a map showing how brain activity changes when the brain is doing different things. In the example we just described, we would see a change in signal shown as a colored blob in the back of the brain, where the visual cortex is. This tells us that this area has been working hard and using lots of oxygen. So, to summarize, how does functional MRI work? As shown in the video, functional MRI is a neuroimaging technique used to show brain activity. It works by detecting changes in the oxygen levels of the blood in the brain.
Okay. So that's the kind of brief summary how the fMRI works. In this study, this paper here, they also provide some of the evidence, right, for different tasks, right, listening comprehension, reading, and both, right, listening and reading comprehension. So which part of the brain activate the most by using this fMRI to give us a clue, right? Which part active the most when perform a specific task. And here, this image kind of shows a fMRI setting, right? So because we are, kind of measure or mapping the brain activities, right? So we have these kind of coil can be wear on the head. And we also have some of the cameras, right? So sometimes they have the mirror to do the reflection so that the patient is able to see some of the, task being given, right? Because we are, giving a task to the patient and measure the function of the brain, right? So for example, this task can be like pick a specific object or identify the location of the object, etc. Right? So you can design different tasks to evaluate the cognitive function of the brain. Okay, so after this task, you can kind of see how different regions of the brain like activate, right? So with different emotions, right, happy and sad, right? So how different regions being activated in this fMRI images. Okay, so that's the fMRI settings.